And for more on this, we are joined now by Peter Mathews, Professor of Political Science at Cyprus College and author of the book Dollar Democracy. Joining us from LA. Great to have your company today, Professor. Why do you think US President Donald Trump is considering restoring partial funding to the World Health Organization?
Well, he got a lot of negative flack from when he cut off the funding, suspended it, because the United States provides about $400 million a year. He's talking about restoring 10%, about $40 million. That's the same amount that China provides per year. I guess he's trying to make a point as well with that number. I think it's not good. You need to go through with restoring the full amount that the U.S. has been committed to and that the WHO needs. After all, it was the WHO that provided the test parameters when the German members in Berlin actually came up with the test initially and shared that with the world. The U.S. didn't pick up on that test, and South Korea and other countries did, and massively tested their populations and did very well. The U.S. decided to do our own test from the CDC, which was delayed because of defects for over 2 weeks, around 2 weeks. So the WHO is very important right now, and President Trump should restore the full funding, in my view.
48 states partially reopening or easing restrictions by Monday. It appears to be a lot of confusion and uncertainty with perhaps business owners and residents across the US states and cities. Do you think there needs to be a single unified strategy here?
Absolutely. And this is the problem with the United States trying to go state by state, 50 states, and they're all having different rules and regulations. They're opening up at different times. For example, Georgia opened up about 3 weeks ago, and they were opening up barbershops and all kinds of places that people would congregate, including bowling alleys. And yet California was much more restrictive, and it was the first state to lock down, and it's kept pretty strict on that and opening up much more slowly. New York is much more measured and scientifically based as well. Each of these states are going in different paces, and it doesn't work in a federal system like this. We need to have a national directive, just as South Korea and Germany did. Germany is federal, and yet the national government took a major role allowing the states to implement it, but the national government put guidelines as to how this should be done. We need to do that in the United States to make it much more effective.
And US President Donald Trump announced on Friday that the US government was working with other countries to develop a vaccine to prevent infection by COVID-19 by the end of the year. However, there are a lot of health experts that say they're unsure about the accuracy of this deadline.
Yeah, I think it's pretty optimistic, and I hope he's right. Wouldn't that be wonderful by the end of the year? Most experts are saying it's going to be at least the middle of next year, so about a year from now, and not just 9 months from now or 8 months from now, as the president is projecting. Let's see what happens. Let's give him the benefit of the doubt, but let's not just weigh everything on that, because you have to be accurate. You have to go with a scientific consensus, and that consensus is this vaccine will not be available at least for a year from now, maybe even just a bit more than that. So let's do other things like social distancing and being strict about quarantine and massive testing and contact tracing. Those are all important things to keep this virus under control. You look at the numbers in South Korea, which do this extensively, and they're down to a -8 just today in terms of cases, and they only had 262 deaths. And Germany had about 8,000 deaths, and the United States had 85,000 deaths because of our careless Hodge-Podge way of approaching this. And I think the administration should be responsible for that, should change their ways and really focus on the way it should be done, other countries are doing it, actually.
And Kawasaki disease, which a lot of health experts are concerned about as well, the life-threatening illness that's linked to COVID-19. We just had a report that at least 3 children have died in the US and at least 100 cases in the US. I want to bring your attention, Professor, to an article that I found on The Lancet, which is, as you would know, among the most influential medical journals in the world. It has made a striking comment which reads, Americans must put a president in the White House come January 2021 who will understand that public health should not be guided by partisan politics. What do you think of this in a medical journal?
It's quite remarkable because that's strictly a technical medical journal, the British doctors. And so for them to come out so strongly and say that the people of America should choose someone who will be serious about this, not partisan, but to unite the country, to go on science and reason to fix this huge pandemic. It's a pandemic, not just a localized or national problem. So that's why the British journal, being outside the United States, it still took a stand and said, please choose the right person that can unify the country and use science and reason to get this under control, because the whole world is at stake here, not just the United States. So it's very remarkable, but I think it's a good thing they've come out and made that statement.
And US President Donald Trump, Professor, has accused Barack Obama of seeking to damage his presidency and labelling it as Obamagate. What is the president alleging, and is there any truth to it?
I haven't, I'm not an intelligence official, so I don't have all the details, but I think that we have been through this before. The president's trying to shift the blame and focus from this coronavirus situation, which he needs to get in charge of, and hasn't done a great job. But he's trying to shift it by saying that President Obama was doing things that were illegal and trying to accuse him of having a collusion with Russia to get him elected, and that President Obama had things to do with Michael Flynn. He's trying to just obfuscate what's really going on. Now, I don't know. We need to find out what exactly was done, the details of that. And I'm sure the intelligence services know about that. There's been nothing. And in fact, President Trump did ask Senator Graham to start an investigation and to call President Obama to be a witness from the Senate. And Senator Graham, who's a Republican and a strong Trump supporter, said, no, this is not appropriate. You cannot do this because you have one head of state, the new head of state, the head of government trying to attack the previous one. It could end up, the whole country could end up in a civil war. Ultimately, I mean, that's pretty drastic, but it could point in that direction. You cannot divide the country any further by doing this kind of thing, in my view.
Peter Mathews, Professor of Political Science at Cyprus College and author of the book Dollar Democracy. Thank you, as always, for joining us on Weekend Edition. You take care.